sessions is to discuss various topics related to health so that people are encouraged to adopt healthy lifestyle. We provide scientific information without any commercial influence. I am Dr. Dhiren Ganjwala, a pediatric orthopedic surgeon from Ahmedabad, along with my colleague, Dr. Sukalyan, who is also a pediatric orthopedic surgeon from Guwahati, will be the host for this session. The topic for today's session is 110 not out and how to remain agile while we age. Longevity has become a buzzword, but it's a burning question whether longevity is blessing or a curse. Those who have seen their dear or near ones suffering in the last few years of life feel that long life is not desirable. They strongly believe that it's not the quantity, but the quality of life which is important. In those countries where health is taken care by government, the authorities are worried about the rising cost of medical treatment due to aging. But on the other hand, a lot of money is spent on longevity research, which itself suggests that people are really interested to live long. Systematic investment plan concept, which is SIP concept, become very popular. But today we are going to talk about HIP, that is Health Investment Plan. And health investment planning is not to add years to the life, but it is about adding life to the years. We are very fortunate to have Dr. Aajay Shah with us. Dr. Aajay is a board-certified cardiologist and a lifestyle management expert in Michigan, USA. He has a great interest in longevity and lifespan. He is also fitness enthusiastic, and at 60, he is a marathon runner and weightlifter. His YouTube channel on lifestyle disease and how to prevent them is very popular, and he has more than 70 YouTube lectures. The co-host, Dr. Sukalyan, is a pediatric orthopedic surgeon, but he also has a great interest in longevity. And as we discussed that after the lecture, we are going to have a question and answer session. If you have a question, you can WhatsApp me your question on the number. Please note down the number. It's 97129 25600. I repeat, 97129 25600. So with that short introduction, now I request Dr. Aajay to share his views on longevity. Over to you, Aajay. Thank you.
Yep, thank you. Thank you again, Dhiren and Sukalyan, for inviting me. I think today's talk, I'm going to try my best to give you the information which you can start using it from today or tomorrow. Instead of going into a lot of theories and a lot of guidelines, I will try my best to give you a meaningful information which is very practical and something you can apply to yourself and your family immediately. So again, like Dr. Ganjwala said, I'm 61 years old now. I've been in the US for last 38 years. I've been a physician for 38 years. I'm a board-certified cardiologist for 28 years. And 6 years back, I got certified into lifestyle medicine with a personal interest of living long. And I'm very big enthusiastic about longevity and health span. And today's talk is a rapid fire list. So whatever you can follow, please follow. And whatever questions you have, please ask me the questions. I have more videos on the same topic on my YouTube channel. So if you miss anything, that will be available on the YouTube channel also. Also, whatever we talk today, please check with your own physician before you start following any of the actions I'm going to recommend you. So Indians are living less than developed countries on an average. And we need to change that because I think as Indians are getting ahead, including getting on the moon now, we need to change that gap of average lifespan between Indians and developed countries. Also lately, I've been noticing that many Indians are getting sicker at a younger and younger age, and every day we hear in the news a young person dying of a heart attack or having a stroke. I also want to understand the concept of chronological age and biological age. Chronological age is the age from the day you are born until today. And biological age is the one where your cells, the whole body, how it has aged in terms of functionality and in terms of health. Also, like Dr. Ganjwala mentioned, that we want to have a rectangular lifespan curve. That means we live very long, and then one day, 1 week, we suddenly get sick and die without any much suffering. Lately, both in America and many other countries, last 10 to 15 years have been spent with a lot of suffering, with a lot of chronic disease, including diabetes, stroke, Alzheimer's disease, and heart disease. So we need to change that, and we need to make our life a rectangular lifespan curve. So following what I'm going to show you today is from my learning, both at a personal level and from my reading for over the last 40 years. And if you follow these practical guidelines, you will be living very long, very happy, and very healthy. So let's start with what are some of the physical attributes one should have to live long, healthy, and happy. In America, the BMI should be 22, but for Indians, BMI should be 21. BMI is the body mass index. You can easily calculate from an online calculator based on your height and weight. The BMI of 21 for Indians is ideal. You can also measure your body fat percent, which should be around 15% for male and 25% for female. Your waist size should be half of your height. So for example, I'm 66 inches tall. My waist should be below 33 inches, which it is. Your resting heart rate should be 50 or below, definitely below 55 per minute. HRV, which is a heart rate variability, should be optimal, at least 40 or above. VO2 max, which is a measure of physical and cardiac fitness, should be above 40 once you turn about 40 years old. So VO2 max is very important. Peter Attia, who is one of the experts on lifespan, clearly says that the VO2 max is as important as nutrition. So VO2 max measurement, which you can easily do by a hospital lab, or even some of the newer handheld devices can also give you VO2 max. Your blood pressure should be ideally below 110 over 80, even though the guideline says 140 over 85, but lower the better, and ideally should be 110 over 80. Maintaining a circadian rhythm or a sun cycle is very important. Our whole body is set on the sun cycle, so our pancreas starts secreting insulin in the morning. Our whole body is geared up for metabolic rate in the morning when the sun comes up, and we are ready to shut down everything when the sun goes down. So maintaining circadian cycle is very important. Let's start about talking about the most important pillar. Nutrition, in my opinion, plays the largest role in how long we will live and how healthy we will live. We should be eating whole food plant-based diet. Whole food plant-based diet means eating more salads, and salads mean not just having the typical Indian salad with cucumbers and tomatoes and onions, but having a lot more green vegetables and different type of fruits and vegetables. Also having dal, fruits, beans, legumes, and intact grains. An Indian diet, a lot of the grains are refined grains, including a lot of the flours, a lot of the white rice. Our grains should be intact grains, including brown rice, black rice, quinoa, oats, millets, and other things. And also having adequate nuts in our diet also. No fast means no salt, no oil, no flour, no alcohol, and no sugar. This is very important because all those 5 things will lower your longevity and will lower your health span. Definitely no soda, that means no thumbs up, no Coke, no Diet Coke, no Fanta, and no many of the other drinks. Definitely no juice also. Eat a whole fruit instead of having a juice. Avoiding processed food is very important. In India, I've seen that many people are eating their lunch or their dinner from the bags and from ready-made foods, and that should be avoided. Sugar substitutes should be also avoided because sugar substitutes also affects the microbiome, and that will also lower the health span and lifespan. No alcohol or drugs, even small amount of alcohol increase your risk of cancer, increase your risk of Alzheimer's disease, and that should be avoided. In terms of the animal products, even though a lot of the Indians are vegetarian, still they have a lot of animal products, including a lot of dairy, and that should be restricted to no more than 10% calories from the animal product. Preferably only a vegan, whole food, plant-based. Having adequate amount of fiber is very important. And in America, people eat less than 15, 20 grams of fiber. It should be at least 30 to 40, preferably 50 to 70 grams of fiber. A lot of people ask me about macronutrient ratio, and in my opinion, the carbohydrates should be about 65%, fat should be about 25%, and protein should be about 10%. In America and even in India lately, protein has become a major craze. A lot of people are eating a lot of protein supplements, and that should be avoided as much as possible. If a vascular disease is present, fat should be restricted to 10%, and protein should be restricted to 10%. The concept of micronutrient access is very important, where you eat a lot of the micronutrient-rich food and eat less calories. Having adequate omega-3 is very important. Having low amount of omega-6, which typically comes from processed oil, is very important. Taking vitamin B12 supplement is must for all vegan and for all vegetarians. Nuts and seeds are very important. Vitamin D is very important. If you are having adequate sun exposure, maybe your vitamin D level is all right, but otherwise vitamin D supplement is very important. Taking a multivitamin with iodine is very important. 1 pound of raw vegetables and 1 pound of water cooked vegetables is very important. 5 servings of fruits is very important, and fruits should be a mixed variety fruit, particularly low glycemic fruits, including berries. 1 pound of beans, legumes, or lentils is very important. Small intake grains, like I said, brown rice, black rice, quinoa, oats, millets. 1 pound of starchy vegetables, including sweet potatoes, is very important. Having a low saturated fat in the diet is very important. This G-BOMB construct was given by Dr. Joe Furman, where he says that if you eat green vegetables, beans, onions, mushrooms, berries, and seeds on a daily basis, your health span and lifespan will be longer. So eating G-BOMBs daily is very important. Having a decaf green tea is very important. In Okinawa and many other blue zone countries, green tea consumption is a regular habit, and that definitely helps your health span, lifespan. Low temperature cooking is very important, and avoiding oven cooking, avoiding pizzas, avoiding high temperature cooking is very important because it makes advanced end glycation products, and that's detrimental to health. Calorie restriction is very important. Eating at home is important. When I was growing up and when Dr. Ganjwala was growing up, we used to eat once or twice a month outside. Now people are eating 4 or 5 times a week, 4 to 5 times a week outside a restaurant. Restaurant eating is very unhealthy, and that should be avoided, and we should be eating at home. Meal planning is very important. Sitting at a dining table and eating is very important. Meal sequencing is very important, where you eat your green vegetables first, followed by your protein and fat, and then followed by simple carb and rice and bread. So meal sequencing is very important. Intermittent fasting, we have covered this topic earlier, and that's also very important, and try to eat within 12 hours per day. Water-only fasting, which is very important, 48 hours and longer, which promotes autophagy and mitophagy. It's very important. Healthy ketosis is very important. If you eat 12 hours or less, then ketosis will happen in last few hours of fasting, and healthy ketosis will happen on a daily basis. Having a light breakfast and light dinner is very important because insulin sensitivity is highest in the early morning hours, and that's why eating the heavy meal is very important. Optimal protein is very important. I know Dr. Ganjwala covered this topic a few weeks ago about not having less protein or not having too much protein is very important. And in my opinion, about 0.8 gram per kg of protein is adequate. And lately, there's a lot of talk about mTOR and rapamycin. If you eat too much protein, you will definitely have a high mTOR stimulation, and that will be detrimental to longevity and health span. Consider raw vegan diet 1 week a month, which will be creating also a fasting mimicking diet type feeling for 1 week, and that will also increase the health span and lifespan. Definitely not eating 5 hours before sleep is very important. Walking before and after meal is important to prevent the glucose spikes and insulin spikes, and that will also increase your health span and lifespan. Having adequate amount of water is very important. A lot of people actually they eat because they actually are thirsty, but their signals get mixed up and they start eating instead of drinking water. So having adequate water is also very important. Let's talk this next pillar, which is a physical activity. Adequate walking is very important. At least 10,000 steps a day, 15,000 steps per day is very critical. I walk at least 16, 17,000 steps per day for the last 6 years. Running, if you can, if your body can allow you for 20 minutes. Regular weightlifting and weight training is very important. Stretches, yoga, and balance training is very important. After a fall, particularly after age 65, mortality risk is very high, and having prevention of fall is very important. Be a Sardinia male. Sardinia is one of the blue zones where male typically lives early morning. They're on the mountains, herding the goats all day, going up and down on the climbs and hills, and those people live very long. So mimicking a Sardinia male type lifestyle is very important, but staying physically active all day is very important. Moving every hour is very important. There's enough studies proving that even if you exercise 1 hour in the evening, but if you sit 8 hours at the desk throughout the day, that's very detrimental. And moving every hour is very important. No matter how busy you are, you can get up every hour and walk for 3 or 4 minutes, and that will definitely be good for your health span and lifespan. Doing more walking social is very important. Last 6 years, most of my social time is with walking, and actually I've realized that sitting, eating food, drinking alcohol is not a good social activity, and walking social is definitely a better social activity than just sitting and mindlessly eating and drinking. Let's go through some of the lab data. A1C, which is a measure of blood sugar control, and diabetes should be ideally below 5.7, preferably below 5.2. Cholesterol should be below 150. LDL, which is a bad cholesterol, should be 70 or around 70. Triglycerides should be around 50. HDL above 50. ALT and ST, which is the liver enzymes, below 20. WBC count should be below 4.2, and lymphocyte, it should be above 40, because with chronic inflammation, neutrophil count goes up, and that's not good for your health and longevity. Albumin should be 4.8 or higher. IGF, insulin like growth factor 1, which is another hormone which behaves like insulin, should be between 100 and 150. Once the IGF-1 goes up, cancer risk goes high. Insulin should be below 5, and you can easily measure insulin by simple blood test. HSCRP, which is a measure of inflammation, should be below 0.2. Preventing cancer is very important. I have a separate talk on my YouTube channel, how you can prevent cancer by simple measures. Please watch that talk. Preventing top killers, including heart disease, cancer, stroke, kidney disease, diabetes, Alzheimer's disease, lung disease, accident, suicide, and medical errors will make you live long. Definitely smoking is a no-no, so no smoking. If you smoke, please quit ASAP. Reverse all the chronic disease, prevent metabolic syndrome, prevent osteoporosis, prevent depression, be in the nature as much as possible. Adequate sunlight is very important. Continue the new learning to prevent Alzheimer's disease and dementia, and having a growth mindset where you set high goals and you also have a high actions also. avoiding night shift as much as possible. Sometimes it's very difficult to avoid night shift, particularly if you are a physician or if you are a firefighter or if you are a paramedic or if you are a nurse. But if you are working on night shift, try to follow as many things as possible from this talk. Having a good posture, good balance, standing upright is very important. Having a health coach, life coach, or personal trainer is an investment, and that should be considered a asset, not a expense. Having regular guidance-based vaccines is very important. Cancer screening, including colonoscopy, mammograms is very important. Yearly physical is very important. Having a good dental care, including daily flossing, brushing your teeth for 2 minutes, and having a tongue scraping, and having dental visits every 3 to 6 months is very important. Sleeping 8 hours is very critical. A lot of people think that sleeping 4 to 5 hours is adequate, but that definitely has been proven to be detrimental to health. Sleeping early is very important. Limiting social media, limiting TV watching, limiting cell phone use is very important. Having some kind of a sauna therapy, including dry sauna, has been proven to prevent heart disease. In Sweden, people use sauna 4 to 5 times a week, and they definitely have shown the benefit in terms of heart disease. Cold showers are very important. Protection from sunlight with a sunscreen is very important. Having a good financial health is very important because you don't want to live 100 and not have adequate money in your last few years of life. So planning is very important. Safe car driving is important. Driving at a speed limit, no texting and driving, no talking on the phone with one hand, and driving is very important. Getting a college degree or more is good for longevity, and definitely higher education has proven to make people live long. Having a spouse or a life partner increases your lifespan and health span, and it's very important to have a spouse or life partner. Help your spouse and help your life partner to have a similar goals in terms of health, longevity, and that will take you along very, very far. Having a family is very important. Having kids, grandkids is very important. Having a purpose to live has been proven to be more important even than nutrition. Having a purpose like running a marathon, writing a book, or seeing your great-grandson's graduation, having some kind of purpose when you wake up in the morning, why you want to wake up in the morning is very important. Strong belief that you will live one time, feeling young, acting young is very important. Mindfulness is very important, and also having an unconditional love with a person, pet, or a plant. There's enough proven studies that when people have unconditional love towards any live being, they live long. Having a hobby is very important. Being a minimalist is very important. Reflect on life every day. Be happy. I have a separate talk on happiness on my YouTube channel. Very important. Happy people live long. Happy people are healthier, and happy people definitely have a better life. Be proactive, be positive, optimistic. Stress management is very important. Increasing parasympathetic tone is very important. Time management is important. Meditation and breathing exercise is very important. Be more spiritual. Visit temple. Visit your religious place at least once a week. And that has shown to increase the lifespan in blue zones. Volunteer as much as you can, like Dr. Ganjwala is doing it every week. Never retire. At least work few hours a week until you are very old and you cannot function anymore, but continue to work. It's very important. Work is actually one of the biggest mental stimulation when you're making those complex decisions. That's better than playing chess or Sudoku. So continue working as long as you can in your later years. Having adequate supportive social circle is very important. Working 40 hours, not more than 40 hours, because you want to make sure that your time is rationed to do other activities in life. Save money, be minimalist, but don't work excessive hours. Journaling every day is very important. Having a gratitude every day is very important. No anger. Be more disciplined. Sometimes I realize that 100% compliance is easier than 95% compliance, and try it yourself and see how it goes with 100% compliance. And having a very focused, phenomenal vision, goal for health and living one time is very important. Share your ideas about health and longevity and make a team, because this is a team sport to live long, and it's very important to have good support players in your team. Stay up to date on health and longevity and research, and keeping up with all the advances into the science. These actions can be started at any age. And even if you start at 60, 70, 80, it will add meaningful years to life. I started this plan at age 55. Before 55, I was very busy as a cardiologist, did not take care of myself, was very overweight, a lot of the issues. And since then, I lost 60 pounds. I've reversed my diabetes. My blood pressure is gone. I'm off blood pressure medications. I ran a marathon last year, and I've been staying very healthy now. You can clearly see the pictures here that I lost weight and staying very healthy now. So you can measure your biological age by Morgan-Levin calculator, which you can easily do by simple lab test, which you have gone through your doctor's office, and it can give you a biological age. You can also do methylation age and telomere age, and that will also give you a biological age. My Facebook page and my YouTube channel is also available if you want to have more information on health and longevity, and please reach out to those two resources. But again, most important thing is that knowing is not enough, we must apply, and willing is not enough, we must do. So actions are more important than knowledge. And today I try to cover a lot of the things, even if you take some simple information and just start applying from tomorrow, you will live long and you will live healthy. So I'll stop here and I'll take some questions.
Yeah, thank you, Ajay, for a big list of points. They're absolutely very well researched and very well supported by the scientific data. But one point I would like to ask before I hand over to Sukalyan for the questions, that now you are 60 and you started doing all this when you were 50 plus, means at the time where you have started semi-retiring. Now, a lot of people like us, Dr. Sukalyan, they are very active and they have to run for so many hours. Like they start their day at 8 o'clock in the morning and they end their day at 8 in the evening. So for them, applying all this is extremely difficult, because to walk 15,000 steps or more than that is next to impossible. So what do you suggest, like for a person like who is in a smaller town like Guwahati or Ahmedabad, it's okay. But someone who is in Delhi or Mumbai, where they are extremely busy, the commute time is too long. How they can find time for all this?
No, that's a very valid question and an excellent question. At the same time, the only feeling I have now is that I wish I had spent a little more time taking care of myself. There is some irreversible damage I've done to myself, which I can never recover, no matter how healthy I get. So I agree with you, it's very difficult. At the same time, I think moving every hour for 2 or 3 minutes, or having a standing desk, for example, like in the evening, going after a meal with your wife, instead of sitting and watching TV with your wife or with your family, going for a walk is very important. If there is a will, you can do also HIIT training, where you can run. When you are young, your joints are still pretty intact, and you can definitely run for 20 minutes, and that will be as good as walking for 1 hour. There are various ways of accomplishing a lot of the things that I showed you in a shorter time. But the key thing is there has to be a will. If there is a will, there will be a way. And I think setting the priorities for health and longevity at a young age is very important. We have a grandson who is 2 years old. And I tell our son that if he wants his son or our grandson to be 100 years old, the journey begins from the birth. And no matter how busy we are, we have to carve out some time for personal health, for family time, for social time. And like many times we have talked about it, a lot of the physicians, they work excessive hours either because they are making too much money or they are having a God complex. And they are essentially ignoring their health, their family time, their spouse time. And that's a lesson for myself. I wish I had learned that lesson from somebody. And I'm preaching that now because I don't want my younger partners and people and friends like Sukalyan to repeat the same mistake what I have done.
Yeah, thank you. Over to you, Sukalyan.
Yes, thank you, Dhiren sir, and wonderful presentation. Really, it touched almost all the aspects of lifespan and health span formally and the secrets. So let me begin with your own life. So when did you get interested in longevity science? And you are a cardiologist yourself. So when you started really getting inclined into the science of longevity, what uh, what is a aspect that you started looking at your own subject about your cardiovascular diseases after you gotten interested in longevity?
Yeah, that's an excellent question. So at age 55, my A1C, my diabetes measure had skyrocketed to 5.9. And I did not want to become diabetic. So that was my wake-up call. And I immediately made changes in my diet, my exercise, and then I got certified into lifestyle medicine. And as I started reading and searching more and more about health and longevity, I realized that it's not a difficult goal. It's just a matter of having desire and having the access to do it. And I was working full time, I was working long hours, but I was still able to achieve a lot of the health goals in spite of my long hours and my busy schedule because I set my mind. Because when it comes down to, for example, when it comes down to eating, whether we eat healthy or unhealthy, it takes same time. So I think it's just a matter of having the mindset to eat healthy food instead of unhealthy processed food. I don't think it's a matter of time. It's having the knowledge and having the mindset. And since I got interested and I got certified in lifestyle medicine, many of my patients, I realized that many of their chronic disease is not because of their genetics, it's because of their lifestyle. And now when I see a patient for 15, 20 minutes, my 5 to 7 minutes are spent at least in terms of guiding them with lifestyle, including their diet, exercise, sleep. And many of the patients have really realized the benefits of the 7 minutes talk on lifestyle. And when they come back to see me in 3 to 6 months, they have made those changes and they have realized that they are going off their medications, they have lost weight, their energy is higher, and they're definitely living a better life by making simple changes. So I think I wish more physicians during their visit talk about lifestyle instead of just talking about the chronic disease.
Great. So that's a very holistic way to approach your patients.
Yes, very holistic. I think to be honest with you, Sukalyan, in life, everything is holistic. When it comes down to having a good marriage relation, it has to be holistic. Raising kids has to be holistic. Same way, staying healthy is very holistic. We cannot be just focused on one aspect. It has to be a complete package deal.
Great, great. So, so you exercise a lot, and do you prescribe? Yes. So, do you prescribe a cookbook formula for how long to exercise? Which are the exercises to integrate, or whether to go for zone 2 or weightlifting or HIIT, what is the thing that works the most?
So for example, weightlifting, it should be 30 minutes, 3 to 4 times a week, and should be compound lifting. So you're utilizing multiple muscle groups at the same time. And the way I follow the routine is a push, pull, and legs. So one day I do push, that means chest, triceps, and shoulder. Then I do pull, that means back and biceps. And then one whole day is dedicated to the legs. So if we do 30 minutes to 40 minutes, 3 times a week is adequate. So that's for the strength training and weightlifting. In terms of the cardio, you should be running 20 minutes, 3 to 4 times a week. And if you cannot run because of your joints or because of age, then you should be walking at least 1 hour per day, every day. And walking 1 hour a day will give you about 6,000 steps. Ideally, it should be 10,000 steps. But if you can at least walk 1 hour a day, will be adequate. And we all should be having at least 10 to 15 minutes of stretching or yoga every single day and a balanced training. So again, holistic physical activity is very important.
Great. And we come across, as orthopedic surgeons, we come across many people who have become old and suddenly they suffer a fracture. Until that point, they had been doing all right. And after suffering fracture, their whole health goes for a downhill. So there is an accident or a fall at home which breaks their bones, and then they're bedbound and everything takes a turn towards the worse. So how to prevent falls at home when people get older?
Yeah, that's an excellent question. So for example, many times fall is because of the inadequate balance training, inadequate muscle tone and muscle strength, including osteoporosis. And many times people who are doing regular balance training, their fall are much less detrimental than people who are not doing balance training and stretches. Plus, if you already have underlying osteoporosis, the fall becomes much more riskier in terms of breaking the bones and spine injuries. And like you said, after the fall, 1 year mortality after age 65 is as high as 25 to 30%. So fall prevention is very important. But some falls are unavoidable. And as long as your fall does not lead to a major fracture, many times you can get away with a simple fall and be all right. So prevention of osteoporosis is also very important.
Great. So along with osteoporosis, another popular term is sarcopenia, which Dr. Dhiren Ganjwala likes to discuss about. So please tell us about sarcopenia a bit more.
Sarcopenia is very under-recognized condition in aging population. And I've seen many people, including America, but even Indians more so, where they have very less amount of muscle in the body and a big belly. And that leads to many chronic disease, including diabetes, osteoporosis. So to prevent the sarcopenia means essentially having less muscle in the body. To prevent the sarcopenia, we need to have adequate weightlifting training, adequate protein intake, and adequate sleep, and many other things. So I think sarcopenia, because muscle growth happens during the recovery and rest. So sarcopenia prevention is a holistic approach again, and it should be done by every person, including female. Even in female, sarcopenia is a major issue. So sarcopenia should be avoided by all means. If you live long, muscle is a sign for longevity. So if you want to live long, you have to have adequate muscle.
Great. And for building muscle, exercise and nutrition are the two aspects.
Yes.
So when we do water-only fasting for more than 48 hours, does it make us prone to sarcopenia?
No, not necessarily. I think I think in my opinion, we should be mimicking the the typical cycle of hunter-gatherers. Hunter-gatherers had anabolic and catabolic cycle. They had a famine and they had a feast. So they had similarly, if we can have adequate calories, adequate protein, and then have periodic 48-hour fasting, that will give us the benefit of both, and that will mimic what our people went through it 100,000 years ago. See, right now, people are eating high-calorie diet for every single day for the whole year. So there is no cyclical thing going on, and that's where, and typically during the water-only fasting, if you maintain low level of physical activity, muscle loss will be minimized.
Great.
Peter here, who says that having some light weight training during fasting is very important.
Great.
So,
So,
Sukalyan, just I would take one question in between related to the fasting part. You mentioned about caloric restriction. The question is about like how much calorie restriction one should carry out.
See, that's a good question. Calorie restriction in all animals, particularly mice and rats, has shown to increase the longevity. When that experiment was done into monkeys, it did not show the longevity benefit, but it definitely showed the benefit in terms of health span and diabetes prevention. So in human, that will be very difficult experiment because it will take 50, 60 years to show the benefit. But at the same time, there was a recent study done called Calorie, where it showed that people with a normal body weight, they were not obese, they were normal body weight, and their calories were restricted by 15 to 20%. They had a better parameters in terms of their diabetes, in terms of their insulin levels, and definitely in terms of the triglycerides and LDL. So all the parameters which are detrimental for longevity and health, they improved with caloric restriction. In my opinion, about 15% calorie restriction is very important. So for example, in Okinawa, not now, but I'm talking about 40, 50 years ago, Okinawa, they were eating about 1,900 calories, while the average Japanese person was eating about 2,200 calories. So they had about 15% calorie restriction. And Okinawans were living about 5 to 7 years longer than average Japanese person. So calorie restriction of 15% is adequate, and it should be started very early. It should be started when you are about 20 years old. In kids, it's not recommended because of kids are still growing with their bones and muscle. But after age 20, so for example, I started calorie restriction when I was 56 years old, and I practiced calorie restriction every single day. I eat about 16 to 1,800 calories per day, and I burn about 1,900 calories. So I'm always in calorie restriction. When you restrict the calories, your metabolic rate goes down. And there is a big fashion right now about raising the metabolic rate with a lot of supplements. But in my opinion, lower the metabolic rate, higher the lifespan. So lower your metabolic rate and you will live long. And calorie restriction will lower the metabolic rate.
Great, wonderful. So parallel to the lifestyle modifications that is being focused in these days in order to increase our longevity and health span, a parallel research is going on about finding a wonderful molecule in order to do that. And some of the molecules which are in vogue these days are metformin, rapamycin, spermidine. So please throw some light into this and how magic pills they can become, or they can at all become or not.
Yes. For example, metformin. Metformin is definitely a drug which has shown to maintain the lifespan even in diabetics compared to even non-diabetics. So I think definitely metformin is a good drug. It works through mimicking the fasting, and it simulates the AMPK pathway. So for example, when my A1C was 5.9, I went on metformin, and now my A1C is 5.2, but I still take metformin partly because I want to have the benefits on longevity. So I still take metformin 1 gram per day. Metformin has shown some concern with your physical exercise ability, but I don't feel that way, so I keep taking metformin. In terms of rapamycin, I think rapamycin is the only drug which has shown to work through mTOR to increase the longevity into animals. But in my opinion, if you restrict the protein to an optimal level, that means not too low protein, not too high protein, then your mTOR will be optimal and your mTOR will be low and your longevity will be maintained. So calorie restriction lowers the mTOR and protein restriction lowers the mTOR. There are even some enthusiastic people who says that even the protein guidelines by American Association is also too high, and we are eating even more protein than even what's recommended. So some people even recommend only 40 grams of protein. In my opinion, that's too low, and it should be at least 0.8 per kg. So for example, I take about 60 grams of protein per day. For I'm about 130, 135 pounds, and I take about 60 grams of protein. So that's rapamycin and mTOR. Spermidine is very important, and supplements are very important. I don't have enough knowledge and understanding about spermidine, but whatever I've read, I think it definitely has shown the benefit. So, but before you go to any supplements, to be honest with you, there are so many things people can change in their lifestyle, which will give them bigger benefit than going on a supplement. So if you start, for example, calorie restriction, intermittent fasting, physical activity, adequate sleep, all those things will give you bigger bang for the bucks than going on any supplement.
Great, wonderful. So we talked about tissue inflammation, and as we said, some of the markers such as WBC count should be less than 4.2 per thousand cubic millimeters. CRP should be less than 0.2. So what can we do to decrease tissue inflammation to the lowest level?
I think that's an excellent question. So for example, eating a lot of processed food will increase your inflammation. A lot of animal products will increase your inflammation. A lot of dairy will increase your inflammation. Inadequate sleep will increase your inflammation. Exercise, paradoxically, will give you short-term inflammation, but the chronic inflammation will go down. So again, having a healthy, holistic lifestyle will lower the HSCRP. 7 years ago, my HSCRP used to be about 1.5, 1.6. Now it runs anywhere from 0.1 to 0.2. My WBC used to be 6.7, 6.8. My WBC now is 3.9 to 4.1. My lymphocyte is about 45%. I also did not show in my slide, but regular blood donation is also very important because having a high iron content, particularly in male and in female after menopause, has shown to cause some heart disease. So I give my blood every 56 days. I donate blood every 56 days.
Great. So as you said, the sunlight is very important for us, and we should have adequate sun exposure. And at the same time, you talked about protecting ourselves from sun with the help of sunscreen lotion. So how do you balance it out?
Yeah, I think if you have about 30 to 45 minutes of sunlight in the morning and, applying sunscreen, for example, many times sunlight, not just because of vitamin D, but because of the depression, because of some of the other benefits. For example, in Sweden, there was a study done where female who were exposed to sunlight, not just the osteoporosis was less, their vitamin D level was adequate, but also their longevity was higher and they were less depressed. So having adequate sunlight is very important, but applying sunscreen, I think if you go out in the sun for 30 to 45 minutes without sunscreen, that will be adequate. If you are in the sun more than that, then just immediately apply the sunscreen.
Does it apply
Okay.
true for tropical countries like us, where we have a lot of sun and we don't have long winters?
I think because of our dark skin, we are somewhat protected in terms of the skin cancers and other things. But at the same time, I think in my opinion, even in India, sunscreen is important.
Okay, great.
Okay, just Sukalyan, one question. Like about the sauna, you suggested a dry sauna. The study which you mentioned is from the Scandinavian countries. Now, does it apply to India, where particularly in Ahmedabad or the southern India, the temperature itself is like reaching 40 degrees Celsius? So do you think that sauna is really important for our country, where most of the time we are perspiring? So what is your views of that?
Yeah, that's an excellent question. I think some of the countries where there is not adequate sunlight or adequate temperature, sauna has a more benefit. And India, I think sauna temperature gets up to about 180 to 210. So I think that kind of high temperature definitely is a hormetic stress. And in my opinion, even though I've not seen any studies, in my opinion, even in India, sitting into sauna at that very high temperature will be beneficial.
Okay. So one of the things I must ask in the context of the city dwellers. So we, some of us live in very polluted cities. For example, in New Delhi, it is said that on an average, people lose about 7 to 11 years of their lives because of the pollution and because of the city life. So in that case, at the same time, billions of people have to stay in the cities. So in that case, how do we ensure longevity and good health while living in a polluted city?
Yeah, that's an excellent question. See, there are certain factors which are unavoidable. And I think to us to avoid those things is not possible. See, I think again, we keep talking about holistic approach. Body is very forgiving. If you have one or two factors which are not in your favor, then body will forgive you if you have other factors in your favor. So for example, if you're living in a Delhi, at least apply other things, including eating healthy, exercising, sleeping, having less blue light, having adequate social circle, not drinking alcohol, and body will forgive you. But at the same time, the reason people in Delhi get in trouble because not just the pollution is high, which leads to chronic inflammation, but the whole lifestyle is geared towards chronic inflammation and having the less health span and lifespan. So, for example, like I said, a lot of people cannot avoid the night shift. So if you're on a night shift, you should only intensify other holistic factors in your life to counterbalance what things you cannot avoid. So just be smart and avoid what you can. And when you cannot avoid certain things, intensify the things which is in your control.
That's such an amazing piece of advice. Thank you. Thank you so much. One school of thought says that there is something called the information theory of aging. So they say why we age is because of the information is still there in the cells, but the cells forget how to retrieve the information and become young again. So that serves as a potential possibility of getting ourselves young to our younger selves back again. So how do you see it as a possibility?
Yeah, I think David Sinclair is a firm believer of the information. Like he says that it's almost like a scratching a CD when information is lost. And but again, I think many times This loss of information is a culmination of lifestyle over not just years and decades, but over the whole life. So I think, like I said, if you want to live long, the the lifestyle has to begin the day one of your birth. So I think if you don't want to lose the information on that CD, on a cell, or on the DNA, start very early. Start as early as 5, 10, 15 years old and be holistic and be as focused and as monomaniac, as single-minded goal of living long, living healthy. And in my opinion, Kalyan, I think a lot of the career goals are actually better served when we are healthy and happy. We are better doctors, we are better surgeons when we ourselves are happy and healthy. So I think our career will go longer and we will be able to work until 80, 90 years old if we start balancing our life at age 20 or 30. So to answer your question, not to lose that information on each cell in each DNA, we have to start very early.
The sooner the better.
Sooner the better.
Okay. Okay. So that might be the last question which I'm going to ask in this session. So as we start thinking more and more in lines of having a longer and healthier life, so our thought process has to change. And what sort of thoughts or plans do you think human beings will have when they will be starting to live longer? For example,
Yeah,
now we, yes,
that's a
yes,
great question. There are many books written on it, and having a multiple careers in life will become common. People having at age 80 or 90 a different career, having multiple spouse will be a common thing. Having a different spouse at age 80 or 90 would be very common. Having a different purpose and different hobbies in life is very important. And according to David Sinclair, many people think that our planet cannot handle the aging population, but it's not the aging population which is a problem, it's a sick population which is a problem. If 100-year-old is very healthy, very happy, very functional, that's an asset to the society from all the wisdom he has gained, and imagining how many people he can guide from his wisdom he has gained will be an asset to the world. So to answer your question, older person, if they are healthy and if they are happy, will only contribute to the society and to the world, and they themselves will have multiple careers, multiple life partners, multiple hobbies, and they will keep advancing the cause for the world.
what a positive way to end it. So we are just a minute away from our timeline. So over
Yeah,
to you,
just
Dhiren, sir.
yeah. Thank you, Sukalyan, for excellent questions. Just the last question, Dr. Ajay, your majority of the focus was on healthy lifestyle, but at present the world is looking for some miracle drug. Like at this stage, we have the two. The first is metformin, and the second is rapamycin. The third is probably NAD is on the pipeline. So what do you think? Are these medicines going to change the game completely? The
In
reason
my
is
opinion,
because whatever little experience I have realized that people are not really interested in changing the lifestyle. They want some quick solution, and that is in the form of pill. So what do you think? What is in the pipeline?
yeah, that's an excellent question. I think I like to give a quick analogy. When it comes down to Alzheimer's disease, there are 100 different drugs which have been tried, and there are billions of dollars research, and nothing has been found because Alzheimer's disease is a disease where there are multiple factors involved. So there is a physician named Dale Bredesen. He clearly says that when you want to prevent or treat the Alzheimer's disease, you ought to look into 36 different factors. And there is not a single drug which will be applicable to all 36 factors. But a healthy lifestyle will hit out of 36, 25, 30, 35 factors. The same with when it comes to longevity and health span, if you want to improve your lifestyle, you will hit more factors. There will never be a single drug which will hit all the factors of health and longevity and lifespan and health span. So all drugs will affect one or two factors, but not all the factors. So I think metformin affects certain things, and I take metformin myself. Rapamycin, similar way. I take an NAD booster also myself. But again, I think those will be complementary to a healthy lifestyle instead of a replacement.
Okay, Ajay, yeah, that's a very beautiful summary of everything that you cannot expect peel for the unhealthy lifestyle. So unhealthy lifestyle is the bottom of the pyramid. Over that, you can build something with metformin or rapamycin or this NAD booster. So thank you very much for sharing your vast experience on the topic. And I'm sure that our audience is going to be benefited by your suggestions. And yes, they are all practical suggestions and all applicable suggestions. They are not really difficult one. So I really appreciate your time and your desire to share your knowledge and experience with us. Thank you very much and have a great day ahead.
Yeah, thank you very much. Thank you, Sukalyan. Thank you, Dhiren. Thank you.
That's so
you.
very
Thank
good.
you. Yeah.
Thank you so much.